One day at a title. I don't know how to do that, so we're not doing it.
All right, we're live.
Okay, it's still setting up on my end. And it is 7. Okay, hold on. I want to see it. I want to be able to see it. All right, Josh, I'll let you disappear.
All right,
okay, it's still setting up on my end.
Oh, okay.
And it is 7. Okay, hold on. I want to
There's a delay now on your video.
It is a delay, but we're gonna move forward. Okay, it's still setting up. All right, guys.
Okay.
We are trying something new tonight. So there is a delay in it, but we're just going to talk and move forward. So welcome to Thinking Thursday. The special, it's a special one. We normally do it on the third Thursday of every month, but tonight, and let me adjust the volume.
Yeah, I think it's.
So you can hear me.
I think we're having like a little Ted Riley moment here. So
Yeah.
I can hear
Let's see if we can work our way through this delay. What we're doing, so you'll know.
I think it's better.
I think we're having like a little Ted Riley moment here. So.
Yeah, we're trying to figure out the delay here. So those of you who are on, we're doing this through Zoom. So I tell you what, my panelists, excuse me, we'll just work through it. Because what I remember someone else telling me on their end, they didn't hear the delay. We heard it because we're on, so we'll just move forward.
Okay.
We'll just work through it because what I remember someone else telling me on their end, they didn't hear the delay. We heard it because we're on, so we'll just move forward. So tonight we have 2 special guests, doctors who are going to talk to us about how COVID is impacting the African American community. We have Dr. Cedric Smith, who works in preventive health care and urgent care. He's a medical director at an urgent care center in Houston and a vocal advocate for the African American community in Houston. And we have Dr. April Carpenter, who is a doctor of physical therapy working with the older population of cancer patients in Houston, Texas. But as always, we're going to start off with relaxation and deep breathing. And we know from those of you who've been here before, know how important it is to practice deep breathing. And I will remind you of how we do that. We're going to breathe in as I count slowly, and then we'll breathe out. You'll breathe in through the nose and out through the mouth. And I'll remind you, the benefits of breathing is going to put more oxygen in your brain. It's going to help your body relax. And for those that may be feeling even more stressful during this time, this is something you can do just to help yourself relax and be in a good space. So let's breathe in, 2, 3, 4, and out, 2, 3, 4. Breathe in, 2, 3, 4. Breathe out, 2, 3, 4. One final, even deeper breath in, 2, 3, 4, 5. Out, 4, 3, 2, 1. So our goal tonight is to talk about COVID-19 and focusing on the African American community and, wow, how is it impacting us? We're going to start with Dr. Carpenter. As I said, she's a doctor of physical therapy working with older cancer patients, and we hear about how it impacts senior citizens. So she's going to start off with us. So April, it's on you.
Okay. It was lovely to see everybody. I hope we get something out of this conversation. So working with the older population, especially with African Americans, classically, we have less access to the hospital system and we have less knowledge about when we should come into the hospital system, especially during coronavirus. So I want to start off with what I think should bring people in to the hospital. One of the signs, if your loved one is ill and you notice that they simply cannot catch their breath, you should probably bring them in for assessment. if they are coughing and you notice blood when they cough, or you notice blood in their urine or their feces, you should bring them in. If they have blue tinged nails or lips, that means they're not getting enough oxygen, and you should bring them in. Or if you notice finally that they're having tremors or less ability to speak or think clearly, bring them into the hospital for assessment. And you can call ahead and say that I think might be, or if your loved one has known coronavirus, you can bring them in and call ahead saying this person has corona and they seem like they're getting worse, so that people can meet you at the door in preparation for taking care of your loved one. From a physical therapy standpoint, if you are ill, the worst thing you can do is simply stay in bed. We want you to sit up more, because when you sit up, you're getting gravity acting on your lungs and you can breathe better. We actually do encourage that you breathe deeply, like Dr. Brownman was saying, so that if you have anything in your lungs, it encourages coughing to cough it up and out of the lungs. You can do activity, and usually activity can help with general muscle and body aches that occur from being ill. So sitting in place and simply marching is a good way to keep your circulation high and to keep your muscles active. You can also raise your arms up and down, okay? And that's gonna help loosen up secretions in the lungs and keep your arms and shoulders strong. And finally, just taking everything slow and controlled so that nothing should hurt or feel worse after you're done moving. From our standpoint in the hospital, you can set up a very similar environment even if you have limited access to things. You don't need to use Clorox and bleach. Soap and water will do. Washing your hands often, 20 seconds on all surfaces. Washing, including the wrist surfaces, will help. And boiling items. So if you have small children and you need to make sure that what they have is clean, boiling their toys, or even microwaving in water to help boil their items will help keep them clean. And basically assuming that you are sick, assuming that if your loved one has it, that you have it, so that you will act a little bit differently, where you'll be a little bit more conscious about washing your hands before you touch yourself or touch your loved one or food. Wearing a mask in public, because that's about to start on Monday. We have to wear a mask in public, and it doesn't have to be anything special. It can be a bandana. Also, when you do interact with your loved one who may be ill, if you know that they have the coronavirus, simply wearing a house coat or wearing a robe to interact with them, and then taking that robe off. It's a very similar process to what we do in the hospital. We wear robes to interact with sick patients, and then we take them off before we go to the next patient's room. Again, it doesn't have to be anything special. You don't have to have any kind of special wipes or cleaning. Basically, all you have to use is soap and water, and make sure that you're washing your hands, coughing into or sneezing into your elbows. That's all I have to say.
All right, Dr. Smith, what would you like to tell us about this virus and its impact on the African American community?
Well, there are a couple of things when you look at the healthcare system as a whole.
Yes.
And when that healthcare system is set up in a way that is not equitable to the African American community, you have to start at that point first and kind of work your way back. When I first started hearing about COVID-19, back in, I guess it was like late January-ish, when it was in China, and kind of starting off in February, they started kind of, some articles and things started kind of trickling out, some news coverage. One of the first things that I was worried about, to be quite honest, was how will this impact the African American community? And the reason why is because we are the most vulnerable, in my opinion. We, on a number of data points, whether it's economically, access to healthcare, education-wise, these type of oppressive outcomes affect us even more. And with that, I was screaming at the top of my lungs on my Facebook posts and other social media posts, trying to tell whoever I could within earshot that, hey, look, let's follow the guidelines and trying to prepare for this, because it's not, for me, it wasn't so much that I was scared about the virus itself, even though it is scary and we're valid in being scared of it, since we don't have a vaccine for it. B, we don't necessarily have a codified treatment plan for it, to be honest with everyone. And so those are some factors. But the main factor that I was concerned about when it came to the virus was that when I know that X person who is Black gets the symptoms or has it, once they're in the system, the disparities that African Americans have to deal with that we know are there. This isn't like made up science. This is heavily researched from any type of, from women's health to pregnancy. You know, we've heard of stories about, this is giving you one, Venus Williams, who is worth, what, $300-400 million, had a child, had her baby, started having some shortness of breath. She was, you know, trying to tell doctors, hey, hello, I can't breathe. And this is someone who we know has access to the best medical care and who was not taken seriously in regard to her symptoms, which ultimately led to a morbidity or increased time in the hospital dealing with a pathology, a health problem that could have and should have been dealt with sooner. So when you know, regardless of what your socioeconomic status is, that the system has disparate outcomes for you, I worry.
Yes.
And I worry because now, 2-3 months later, after I was talking about this and telling my friends that, hey, look, we are going to have people in our circles. You know, I played football with this guy that was from DeSoto, Texas, and he is, a track coach in DeSoto, and he has now passed away. This is a person, we weren't friends. I didn't know him personally, but he is in our circle. So now we're starting to see that now. And because of that, we have to be vigilant. No, we have to be hyper vigilant about following the guidelines of coughing into your elbow, not touching your face, washing your hands frequently, social distancing. Now, I do understand there is an abundance of privilege in being able to social distance. So for instance, with me, being that I'm a physician and I happen to make, pretty good living, here I'm in my apartment. It's a 2-bedroom apartment. I'm by myself. I'm not married. I don't have any children. So for me, I can easily social distance. However, I do know that I got some cousins and some aunts who have more than, one person in the house, or 5 or 6 people in the house. This is the reality, that because of those data points where I talk about the disparities that occur economically, these are real situations that people are dealing with that look like me and you. So having to get on a bus, transportation, one of the biggest determinants, or one of the biggest detriments in the access to jobs is transportation. Not everybody has a car. We assume that, oh, you got a car, you just drive to work. No, people have to ride buses, people have to ride trains, whatever the mass transportation is. Well, it's very difficult to social distance when you're packed into a truck, a bus, or some form of transportation that has to get you to work. So these are the factors that heighten the risk and the relative risk for the African American community that I'm most concerned about. And so going forward, this is not over. They're talking about the curve is starting to flatten out in some areas. I think at this point we have to be hyper vigilant, because now we're seeing that the disparities are bearing out. You make up 30% of the population in some place, but you're 70% of the cases that are in the hospital. You make up 18% of the population in a certain area, and yet you make up 6% of the cases of COVID-19 and the majority of deaths. And so the disparate outcomes are playing out deathly when it comes to African Americans, unfortunately. And so my scream, my clarion call, if you will, is to try to educate as many as I can and to warn and say, hey, look, do the very best that you can. Nothing's perfect. I get that. But if we can, for instance, even in my family, we have like a Facebook thing for our like cousins, our family reunion and so forth. And we're not having family reunion this year because of COVID-19. But I noticed on a post where one of my smaller cousins had ridden his bike down to an older cousin's house. And everybody's posting like, oh, it's such a great picture and it's awesome, and it's cute. And I'm saying to myself, this is exactly what we should be doing. Yeah. I can see as a child, they're kind of just want to go and see Uncle so-and-so or Aunt such and such. But we have to be the responsible ones and say, no, this is not proper. If you don't live in the same house and you have the opportunity to not have, the social distance when you can, then you have to have that responsibility to say, no, we can't meet like this. That is an opportunity for an infection that was unnecessarily risk that was taken. So it's things like that we have to be hyper vigilant about. And I'm concerned. I'm concerned, y'all. I still am. So as even though they're trying to open up Houston and open up some of these major states and cities and communities for the African American community, I'm very, very concerned.
And I share those concerns. So here's some questions that have already been put forth. And I will say anyone who is watching, if you have a question, you can type it in the comment section and I'll be watching the comment section. But some questions have already been emailed to me and I'll start with those, but feel free. That's what they're here for, to answer questions. But I've got a list that others were already concerned about. And so just starting out, what can families do inside the home? Like you say, you live alone, it's just you. I have one child and we have a 3-bedroom house, so we can, we have space. I do still have to go out to work.
Yeah.
So I'm still going out every day and I'm doing and I'm going to get you guys to talk about that, changing the clothes, showering, not having any interaction until I've cleaned. I wash my hair every day because I'm doing the whole top to bottom. Right. But what do you say to someone there? I have clients who maybe there are 12 people in a 2-bedroom house. What do we say to them? How do they address social distancing?
Well, obviously it's very difficult if you are in a one-room house or a small house and you've got multiple people. You try to isolate that person as much as you can if that person is ill. If you have an ill person, and you also try to limit the interaction that person has. So if someone is the carer for that ill person, let them try to be the only carer for that ill person to limit the amount of people that could have potential contagion. And it's been shown that masks do work, or a face covering does work. At work, we actually wear masks to keep our own secretions or to keep our own coughs and sneezes in, encouraging an ill person to wear a mask. And if you're in close contact and you can't do 6 feet, everyone wearing a mask or a face covering in the house is encouraged to keep everybody's sort of coughs and sneezes at bay, or their breath at bay, contained within a mask. Again, it's not ideal, but isolating that person to a corner of the room, or if people can move out of their way and keeping them sort of in one area, keeping them limited to one cup, one bowl, one set of utensils, can help limit the amount of spread amongst the family itself.
It's a very difficult question to answer, to be quite honest. Typically, I have found in a lot of activist work that I've done is that it's very easy for those who are in very privileged positions to try to tell those who have 12 people in a house how to manage the 12 people in the house with no experience in doing that, right? So it's almost like we always tell homeless people what they should be doing. Well, you should just go out and work. You should do this and you should do that. it's very hard for me to tell a family of 12 exactly what they should be doing, without making mistakes, without having some empathy and compassion for. That's a very difficult situation, first and foremost. In the United States of America, where you have 12 people living in a 2-bedroom house, that's, 800 square feet, just the logistics of it is difficult. I don't know how you manage that, to be quite honest with you. But for the controllables that you can do, the washing of the hands, not touching of the face, if you have access to masks, and that's another thing. I think Houston has a few areas. You can probably call 311, the Houston local number, to get. They just published it, where there are places that are going to be giving out free masks if you have transportation to do that. Another thing is that there's another organization, Houston Justice Coalition, that is just now putting together kind of a program where you're able to call in if you're not able to go and get the mask, because some people don't have cars or rapid transportation that they can get to places easily, to where people can bring masks to you. I don't have the numbers for that right now, but I know it's Houston. I think it's HoustonJustice.org, maybe their website, but it's Houston Justice Coalition here in Houston. And I know they just announced some places where you can get masks here in Houston. You probably can go either call 311, which is the kind of the Houston helpline number that you can call to see where those are. If you have access to the internet, your phone, you can probably look it up. I know it was on the internet earlier. They were giving the sites that you can go to. But getting back specifically to your question, it's getting back to the hand washing if you can, the coughing into your elbow. As far as bathing and showering, construct, that may be a little difficult in a 12-person household, but it's trying to have at least a responsibility for your personal, your personhood, your personal space, in regard to being, empathic to and responsible for others that are in the area.
Yeah. And I get that example of 12 people. That's actually thinking of a client I have, and we had that discussion. Now, when we're talking, before I get to some of the other questions, you both talked about face masks or face coverings, and there are people who can get them. Now, some of the things that I've seen is you can make a face covering out of, you can take an old t-shirt. There are things on the internet how you can, maybe cut the t-shirt, and then they show you how to use rubber bands or how to use something to make a face covering.
Sure.
So for those who can't get the mask, even if they're free, so maybe you dedicate 2 or 3 old t-shirts and everybody has their mask. What do you guys think about that concept anyway? Just making it from, that's what I've seen, making it from clothes and different things.
Well, from what they've discovered through research is that anything is better than nothing. So yes, using that old t-shirt, using that handkerchief, but folding it enough so that it's not so easy for you to breathe. You want it to be a little bit difficult for you to breathe, because if it's so easy for you to breathe through, then that means that everything's just potentially coming through. So with all of the tutorials that I've seen with the bandanas, they're folding it several times. The more layers you can add, the less likely that your breath and your secretions are going to be coming through that mask. So if you just took a single handkerchief and put it over your face, that's not as good as folding it several times before putting it on. So yes, anything is better than nothing at this point. And then of course, coughing into your elbow or sneezing into your elbow to reiterate that. And I think also to his point, just taking care of your person and your personal responsibility. Again, if you act as though you potentially have it and can potentially give it to others, you will interact with people differently. Like when you know that you have a cold, you know that you try not to share drinks, you try not to share food, you don't share utensils, you're trying to keep people away from you. Even if you can't keep people 6 feet, knowing that you're sick, you do interact with people a little bit differently than if you believe you're healthy. So those things can help.
And the piggyback on that is, if in that particular kind of extreme situation where 12 people in that particular household, there's almost like a covenant or a pact that group has to make with themselves. in that of the group, there may be X number of people who are going to work or essential workers. Knowing that there's a responsibility when you're out in the workforce, that you're responsible for yourself, because you're potentially bringing stuff back home to your family. You know, even though I don't have a family here that I'm bringing things to, one of the things for me, even when I go out to get, you know, groceries, I have a mask, so I wear a mask, but I specifically go in, get what I get, and leave and use the automatic checkout if I, you know, can. I don't want to interact with anyone. And one of the reasons is because I know I'm at higher risk. I know I am a higher risk to others because I'm seeing 30 patients a day or 20 patients a day and interacting, even though I'm very hypervigilant about wearing gloves or washing my hands a million times. I got the driest hands in the world. Doing all the things I can do, I still know that just the mere presence of being in that environment makes me more of a risk. So I just come home. I don't go back out. You know, it's hard. It really is very difficult. But in that particular situation, I would say having a plan of like, look, you know, I know you're going to have some people that are going to want to interact with you at work in ways that are a little loose than what they should be doing. Yeah. And so we have to have a pact with each other to say, no, look, you know, I have a responsibility not only to myself, but to, you know, 11 other family members. So that's what we have to do.
Getting to some of the questions that have come in on Facebook, understanding COVID-19 and its impact on communities of color, what are the recommendations or concerns of women of color? And they also want to know that they feel like, you know, right now some pregnant women of color are saying how they're being dismissed, that they have concerns. But are there concerns for pregnant women?
Sure. I mean, yeah, that's concern. I mean, the concern is that, you know, you're carrying, you know, your child. So I'm not an OBGYN. I don't know what the specific guidelines from that standpoint are, but from a COVID-19 standpoint, the way in which you process your particular illness as a woman, as a potential patient, still kind of carries that, you know, if you have a fever or cough or things of that nature, you're going to need to first call probably your OBGYN to get advisement on that concern. But those barriers of like, unless you are literally like deathly ill, you know, really getting severely ill with the shortness of breath, you know, she talked about the cyanosis, the blueness of the lips, difficulty breathing, coughing. You know, if you're getting really, really sick, then you have to be seen. You know, it's just the way it is. Now, we do know there are cases out there. I have read in the newspapers, read on social media, where there are people who went to 3 and 4 ERs and were turned away. This is a part of the disparities in how it manifests, how it shows up. And so there are some Black people and people of color who are going to have a wonderful experience in dealing with the healthcare system. The reality is that the relative risk is higher. Mm-hmm. And so when you know that, that's when it gets difficult and hard for somebody to advocate for you to get in to be seen. And you have to be persistent. You know, I don't know what that looks like. Do I call 911 and have the cops show up? I don't know what someone has to do in that desperate situation. I just know that relative risk is there.
To those of you who recently came on, let me introduce again our guest. We have Dr. Cedric Smith. He's a preventative health. He works in preventative health and urgent care. He's a medical doctor and director, of an urgent care center in Houston, and a vocal advocate for the African American community in Houston. And we have April Carpenter, who is doctor of physical therapy, working with older cancer populations. We have a few more questions that have come in. If you and your family have been in your house and haven't been out since the beginning of this whole shutdown, you actually stayed in, do you have anything to worry about? And I don't know how you have not been out, not to get groceries or anything. But if you have minimal contact, let's say the only thing you're doing is, you know, it's been a month now, you need to go out and get groceries, you do that and come back in. Do you have anything to worry about?
Yes.
Yes.
I mean, unless you are locked down to the point that you have a year's worth of food and you don't have to leave, period. Everyone was tested, for COVID-19 and tested negatively for the test. And we all know that. And at that point in time, we were all isolated from the whole world and have a bunker. I mean, yeah, do you have anything to worry about? I mean, the risk is very, very infinitesimally small, very, very small, yes. But I mean, as far as like, if you stepped outside of your domicile or your house and you breathed in some air finally, is the virus aerosolized or something like that? Like, I mean, yeah, there's really no chance you're probably going to get it. But I think we should all worry to a certain degree. And that relative number that, on a scale of 1 to 10, your worry level is a 1, 0, I'm sure. If in that utopian, situation, I guess, that's like the perfect situation. Like I was able to isolate for 3 months, but in some ways people have to go to the grocery store or go get gas,
Yes.
or, just little things. I mean, you should tank up. I think people should have their cars like ready to go if they have cars. But yeah, if you were able to just like totally 100% isolate, I mean, your worrying is very little, I guess, but we all have family members.
Yeah.
So even though I may be doing everything right, I still worry about other folks that are in my community and my family. So the worry level is just unbelievable still.
And I think some people forget to understand that, okay, you may stay in, but you're having things brought to you because you're ordering everything, you're ordering your groceries online, and you might have meals, but then that's still contact with the outside world.
Yeah. I don't know what this particular
totally out.
Yeah, I don't know what this particular situation is. Yeah, if they're doing that, there's still risk in that. But, it's not like they were given like the perfect situation. But I'm like, if you get a card or, something delivered to you, there's still contact.
Yeah. Mm-hmm. Wash your hands.
Here are I'm going to combine some questions and explain asymptomatic. And, we hear that, but I want that word a little broken down too. And how do you distinguish between flu, allergies, and COVID-19? Just looking at the symptoms, what are some symptoms? And if you're asymptomatic, I'll let you guys talk about that. Make sure it's coming from a medical professional point of view.
You want to go?
Well, I was just going to say, with asymptomatic, you can still be positive. You can be
right, but explain what that term means.
I'm sorry. Oh, so asymptomatic.
Some people weren't understanding, so I wanted to make sure, not to insult anybody, but somebody asked, and so I wanted to, put that out there.
Asymptomatic means that you develop no symptoms associated with COVID-19 at all. So no coughing, no sneezing, no shortness of breath. You have no symptoms. That doesn't mean that you don't have the virus. It just means that your potential vectors or your potential pathways to spreading it, where you're coughing in someone's face or wiping your secretions onto a surface, are a little bit less. It doesn't mean that you can't also spread it.
So you can be asymptomatic and still spread the disease.
Yes, you definitely can be asymptomatic and spread it. So I like to look at it like this. So, when we talk about just the common cold, right? The common cold, you got the stuffy nose. You typically have like a cough. You may have runny eyes or something like that. Sometimes the symptoms kind of overlap between allergies, COVID-19, and a cold. There's really no specific demarcation per se. I've seen COVID-19 patients come in who exhibited the full gamut. They had the cough, they were febrile or had a fever. One had conjunctivitis, which is redness of the eyes, like pink eye that people see. And they had the full gamut of it. I had some people come in and just had abdominal upset. And so those are considered symptoms, things that manifest that the disease pathology shows that comes out via some type of, pathology like coughing or sneezing, whatever the case may be. That is a symptom. But there are some people who feel, and just put in layman's terms, they feel like, I feel normal. Yeah. I feel like nothing's wrong. I mean, I may have had a little like fever or felt fevers, but for the most part, I felt my normal self. You were asymptomatic, but you were infected with, let's just say, COVID-19 or your allergies, or you're infected with a bacterial infection of some sort. Or even like if you have a rash, like there's some people who have eczema. All right, let's give you a skin condition. But during this time period, the eczema doesn't break out, right? So your skin looks perfect. You're out in the sun, you've been getting good vitamin D, you're asymptomatic. Do you still have eczema? Yes, you still do, because 6 weeks from now, you're gonna have a breakout, and they're gonna have to give you some medication for it, or whatever the case may be, but you're asymptomatic. So hopefully that kind of helps you understand what asymptomatic means relative to the disease process that you have. And that's what asymptomatic means.
And I also think in this case, there's pre-symptomatic as well. So asymptomatic means you never develop symptoms, and pre-symptomatic means that you don't have symptoms. Say you get tested, because they're doing asymptomatic testing now for the community in Houston. So you get a positive result, but you feel okay. That means that you just, and then maybe a week later you develop that coughing, that sneezing. That means that you were just pre-symptomatic. At the time that you got tested, you tested positive for coronavirus, but you just happened to not have symptoms, and then later you develop symptoms. That's pre or before symptoms state right there.
And that's a very good point. I've actually had, and this is probably one of the problems with the testing. So we'll draw a test on somebody. We were told initially the test would take 3 to 4 days. Mm-hmm. Even that is a long time when it comes to this type of illness. So when you go in and you get the flu test, if you've ever happened to have gotten a flu test, it literally takes 15 minutes, right? If you take a strep test, a strep throat test, that usually takes 10 minutes. So I literally know within the visit whether you're positive or negative. With the COVID-19 test, we were told 3 to 4 days. In my experience, and what I've been testing people, it has been taking 8 to 9 days to get the results. And so when I get the results back, I have to tell the patient, you were positive or negative 8 days ago or 9 days ago.
Yes.
And that really doesn't help, because the person's been back to work, they've been, with their families, they've gone to the grocery store. They literally could have picked up COVID-19 after that. Yes. If that makes sense, after they were tested, because it's such a long window to get the results. And you bring up a good point about being pre-symptomatic. So the person was positive. I actually had this happen. A person, we did a test. The test was positive on the day that we drew the test. The person was asymptomatic on that day, didn't have a cough, felt normal, felt everything was fine. But then about 10 days later, had a little cough, had a little feverish feeling to them. And so they were symptomatic at that point, which means they were pre-symptomatic when the test was taken, if that makes sense.
Well, and that's why I think it's best that everybody assumes that we just have it. So if you assume that you have it or have the potential for getting it, you are going to try to interact with people, like, again, make that pact and interact with people differently. Instead of going in for that hug or that kiss, or if you're shaking hands, you're going to be washing your hands afterwards. You're going to be avoiding those types of contact because you have it, and that's not to scare anybody. That's just so that people can distance as much as they possibly can and try their best to take your phrase, to try their best to distance themselves in multiple situations.
And God, and we know it's not easy. Listen, no. One of the things that I'm very real about is that, look, I can sit here and button up the shirt and be like, oh, I'm Dr. So-and-so. At the end of the day, I'm Cedric Smith. I wear the white coat from 8 to 5 on Monday through Friday, but I'm still a human being, and the behaviors that I have are dictated because of that. Like, I still have desires. I date, so I want, a young lady called me the other day. She's like, can I come over? No. And I was like, I do want you to come over, but I can't have you come over because I am more of a risk, and I can't do that. As much as I desire for you to come over, believe me, I can't do it right now. It's just, I'm gonna have to bite the bullet on that. I'm sorry. So these are real issues that we have to deal with, and I don't want anyone to get out there and think like, they get to talk about this and they're not really realizing what all we're going through. I can only imagine what you're going through in different circumstances of 5 or 6 people in the house, 4 or 5 people in the house. You're separated from your mom that's right down the street and you can't really, you've got to drive by and go see her, or your dad, things of this nature where you have to really modify the behaviors when you're accustomed to being there every Sunday, or, going by there every Wednesday, or having dinner night with the family. This is not easy. It is not easy. But the warning that I have and that we have here is that, listen, we're trying to get on the other side of this thing because the system is set up in such a way that it doesn't treat you equitably. That is a fact. That all that Jerome, the Surgeon General that came out and was talking about, tell Bebe's mama and so, Abuela, don't drink, don't smoke, don't do this. Like, nobody was saying that about the Italians when they were in lockdown. Nobody was saying, like, what are they eating? What are they drinking? Nobody said that. And they were dying like crazy, right? So to put the blame on you as an individual, if you're out there doing some, deleterious behaviors during this time period, hey, it happens. People are drinking. I've seen people come to my office who are not African Americans who have what is called esophagitis. That is because people are being isolated, those habits that they are drinking more. They're having wine during the day, maybe 2 or 3 times more than normal. And that happened. That's a reaction to the stress. People are under a lot of stress. I've probably gained 20 pounds just from worrying about my mom and dad who are 90 years old and 85 and family, and getting texts from friends who are COVID positive and trying to guide them through it. It's stressful. And we understand that you are stressed as well. I want to make that abundantly clear. This is not easy. And we understand the frustrations that you're going through. And you're not perfect. We get that.
I've got a few more questions. You guys have a little more time, doctors?
Oh, go ahead. Yeah.
Awesome. Couple of questions. One, I'll take one, and then I have one I want to ask from the Facebook. But what do you say to people, seniors? And I know, April, you work with seniors, and you, Dr. Smith, work with in urgent care. What do you say to seniors who are like, no, I'm not feeling good, and I call my doctor and he says I need to go to the ER, but I'm not going to the ER because I'm not going to die alone. They may keep me there in the hospital. And that's a real fear. I've heard that more than one time, not even just from seniors, but people, I'm not going in. What do you say to them?
Well, if you are already socially isolating and you are by yourself, if you don't go in when you begin to have symptoms, you may become incapacitated. What they recently found out is that a couple people who died at home back in February actually tested positive for COVID-19. So in that case, they potentially died alone already. I would say that if you get medical attention and you try to get it early, generally the outcomes are a little bit better than if you wait until you become incapacitated. And then you either would die in the home or you would still go to the hospital and die alone. It is a very difficult question because we are limiting the number of people that can come into the hospital in and of itself. Basically no one can have visitors because of this pandemic. But also, if you are known to have COVID, in the hospital system, we're doing everything that we can to give people that last contact, but to limit infection, yes, we are limiting the amount of people that can come in. You're surrounded by us. We're your family at that moment. We know it's not as good as having your family there. I would say though, don't wait.
Well, not just people with COVID. If someone has other health issues, they're afraid to go to the hospital right now, thinking if I go, I'm going to get it.
And
these are things that people are saying. What do you say to that? They're avoiding other health issues that could be serious and could be life-threatening.
Yeah. That makes perfect sense. First of all, they are valid with their fears.
Yes.
They're validated in being fearful of going to an emergency room and being evaluated, and also valid in the fear that, that they may end up there and never come back. Most people survive COVID-19. I mean, we don't hear about it as much when it comes to the numbers of people who survived it. However, I would recommend to the persons that you speak of, if they do have other family members that, yes, they are isolated by themselves, they live by themselves, we have to start coming up with a protocol. I would, if it's just so simple things like, hey, look, if I'm definitely ill, I'm gonna text you this, and you got to come get me. And when you come get me, you wear your mask, and you do such and such. We don't talk. Well, you take me to the emergency room, and we got to do such and such. We got to go. It is a catch-22, but at some point, you have to start thinking about what trigger is it going to be for me to say I need to go to the emergency room. Right. Because at some point, I think there's going to be a survival gene that's going to kick in at some point and say I need to be seen because I'm barely breathing. I'm barely able to. One of the things I tell patients, just to let you know, one of the things I tell patients to do if I have to assess them through telemedicine, like visually, from a breathing standpoint, I tell them try to count to 30 as quickly as they can, but as clearly as they can with one breath. So it'd be like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, right? So I didn't go 1, 2, 3, 4, 5. I had to stop. That's a good indication of whether or not your O2 stats are good as well, like whether or not you're getting enough oxygen in your lungs, to make it simple. But yeah, try to have a protocol with other family members that you trust, and you're very valid in your fear of going to the emergency room. But now they have, because it's been a couple of months, most emergency rooms have a separate pathway for you to go through. If you're non-COVID, you can go this way and get seen for your, I feel chest pain from heart disease or something that you think is like I have a history of heart problems, and most likely it's due to my angina or coronary artery disease, that they can take you through a different pathway that's separate from the COVID area. I think now people are able to cordon it off. And you probably can call ahead of time and ask, hey, do y'all have that type of procedure? We don't want people calling 911 and being fearful. Let me say this. Call 911. We don't want you to be fearful of not calling 911, thinking that you're not going to be assessed for your problem. But your fear is very valid. It's a very valid one, and I don't want to diminish that concern that you have.
To add on to that, what recommendations do you have about how do we check on seniors? There are seniors who live alone. There are people who live alone who are not seniors, who still could be ill. What recommendation do you have to check on just people who are living alone? Is there anything past just calling them? And let's say you call them and you hear it and something doesn't sound right, feel right to you. How do we check on people who live alone?
I know
it's a hard question, but
no. Part of it is access and resources, right? So we just lifted the state of tech. Well, nationally, they just lifted this kind of telemedicine rules and regulations that we have had before. I don't know if the elderly person has access to a cell phone. Sometimes they don't.
Well, I just meant, how do you as a person? I know Auntie May lives by herself. I don't know if anybody's checking on her, so I'm just going to give her a call. Now, when I call her, I'm just not sure. I don't feel right when I hear her. What would I do? I'm checking on her on the phone. Is that the only way we can check on somebody? And if we check on them and don't feel good about that check-in, what would we do?
I think one of the things, if you're able to go see your aunt or uncle or whoever the case may be, I would say do the precautions of, if you have access to a mask and gloves and some type of covering that you can throw away or wash immediately when you get home, I would say at that point, I think you have to go check on them physically. Okay. If you can. At some point, I'm just thinking about it in the case if it was my mother or somebody I really care, one of my family members, I'm going to try to check on them. Mothers, if I got to say, hey, we got to open the door and I can social distance and see you and look and put my eyes on you,
Yes.
And that's what I got to do. For the person that's totally isolated, doesn't have anyone, I mean, hopefully they have, I don't know, to me, the resources of a church group, somebody's got to be able to check on them. That's a tough one if no one has anyone. I don't know what the services the city of Houston has in that regard to even know someone who's living in a situation like that. But yeah,
that's even a help for those who know someone. Like I say, you might know someone, and just that take the precautions and go and physically check on them. We all, I've talked to more than one person who knows seniors who are living alone, and are having a hard time, and you just feel like you need to physically check on them because they already had underlying health conditions. I'm already 85, and so some things are breaking down in my body. What do I do? Switch gears. Oh, go on.
To piggyback on that, part of the things we don't do, if you have like some shades or glasses, I would recommend wearing those as well, because the person going to see the elderly person has to assume they have it, and you have to act accordingly. So that's what I was saying. Cover your mouth. I would say even glasses or shades, even, because that's another thing that is the T zone: ear, eyes, mouth, nose. It looks like a T. These are live areas that droplets can get into and cause infection. So if you're going to see somebody elderly and you have on a mask and it covers the nose and they cough, then a droplet technically could get into your eye. That's why we've seen some cases where people had conjunctivitis. Now, most likely it came from them rubbing. They hit something and then rubbed their eye. But also it's a living membrane in your eye that a virus can settle in as well, if that makes sense.
It is. That's good. Let me switch gears a little because we're going to try to kick off about 8. It would have been an hour. And we might have to do this again. You guys, we might invite you back. And it's great information. Here's a question someone asked. Let's say we're again talking about economic disparities. What if I don't have a washer and dryer at home? And I know laundromats have protocols now about you can't fold the clothes there, and they have different things. They're only giving access to every other washing machine, every other dryer, things like that. But what if I have to go to work? I have to go outside the house every day, and I really can't afford to go to the laundromat. I am taking my clothes off. Are there ways you can at least disinfect your clothes, like spraying them down? If you spray your clothes down with Lysol or these things when you get in, does that make a difference? Or do you know?
I'm pretty sure it would make a difference if you spray your clothes down with Lysol.
But it would hurt you too.
No, I mean, take them off. The question is,
Lysol on your skin is not normal.
I'm saying they were saying when you take the clothes off,
and
you can't readily go to the washing machine, go to the laundromat, washateria. Can you spray your clothes down?
Honestly, boiling water and having the clothes be in boiling water, because again, who has access to Lysol wipes anymore? No one. Right. No one can get them. So if you have access to hot water, either boiling it on the stove or in a microwave if you have a microwave, or if you have an electric kettle, doing that and letting your clothing soak in soapy hot water is going to be better without worrying about some product that you need to grab now from the grocery store as well, and washing your clothes like that. So if you have access to a plastic bucket or a metal pail, that now becomes your designated COVID clothing bucket, where you just throw it in, you throw that hot water in there, you let it soak for about 10-15 minutes. Then you can let it air dry generally, and that will help more than trying to find a product and spray it down, because Lysol in and of itself is not meant for clothing.
Right.
So it's not actually, we don't actually know how effective it is in getting rid of the viruses on a piece of clothing. And also those type of harsh chemicals within Lysol and bleach and everything, they break clothing down. So now you're taking a potential barrier against virus, and you're breaking down the integrity of of the cloth itself. So boiling water and soap is going to be your best friend more so than some product.
Good.
That's a tough one. That's
It is a tough one though too.
But the idea, and I'm sure people hadn't thought about, oh, you could just get the water boiling hot and that will clean. So I think that's good information.
Yes.
Trying to look at my list here and look online, and there was something else I wanted to. Looking at just general healthcare, we're talking about their disparities. And like I said, one of the biggest comorbidities of coronavirus dealing with the African American community is systematic racism, how things are inequitable in our community. So another one of the inequities we haven't talked about is just food. Now we talked about healthcare, but healthy food outlets in terms of just the grocery stores, if you are going to the grocery store. And you have food deserts in Houston and in other places in Dallas where I am. Are there benefits to in managing this disease and what you're eating? And just speak to, just the whole healthy lifestyle. But if you're in a neighborhood that doesn't give you that opportunity, what suggestion? So you got to get on the bus to go somewhere healthy. Now you're having to get on the bus, which might not have the same social distancing availability. How do you manage that?
Yeah, that's all. I mean, you manage it the best way you can.
Yes.
Poverty is impactful. Poverty is not easy, right? I tell people all the time, look, I grew up in a situation, not that I was wealthy or anything like that, middle class family. I've never been hungry a day in my life, okay? However, I do know some people who I grew up with who were food insecure for 200 some days out of 365 days a year, who moved 7-8 times out of an apartment complex within 1 year, where my home that I grew up in is still in the same spot and we still own it, to this day. So I don't know what it is like to grow up in that situation, but I do know it does exist. And I do know that I was very lucky, all right? And trying to navigate the disparities that exist both economically, where I think the average net worth of African-American family right now is some 10 to 20 times less than the average white American family. I think right now the number is like $3,600 headed towards zero. And that means the richest person from, Oprah Winfrey to the poorest joke over in Third Ward somewhere. I don't know, the poorest black person in Fifth Ward or something. But the bottom line is that these are real impactful intersections that lead to outcomes that are very hard to overcome at this particular point in time. One of the things I'm definitely worried about going forward is that the income disparity and wealth disparity is going to increase after COVID-19. Anytime we've had this type of, like 2007, 2008, you had the collapse of Wall Street, the income disparity has gotten worse since then. Again, we're at another kind of critical moment in history, a pandemic, that we haven't had since 1918. And again, my biggest fear is that, which most likely will come true, is that you're going to have an even larger disparity gap when it comes to all these indicators and comparisons for African Americans versus other racial groups. So it's very difficult, and is one of the things that puts African Americans at such a risk, because those comorbidities are associated with that. Food, as we know, in Western medicine, we're taught a very strict way of looking how we apply medicine. There's a problem, we diagnose that problem, I give you this medication that I write a prescription for that is supposed to deal with that problem. You have strep throat, I give you Bicillin injection and it takes care of it. However, even though I'm not trained in Eastern medicines or African medicines that are out there, or natural medicines or naturopathic medicines, I'm not one to discount it. So when it comes to things like turmeric or turmeric, as some people pronounce it, or even vitamin C, pills, if you can get that, as a supplement, it's supposed to help in regard to your immune system. Or ginger, which is good for the abdominal system, or things like garlic that are supposed to be good for building the immune system. You know, I'm not here to say that it's like junk science and it has no beneficial factors. I'm not going to say that because there are some studies out there that look at alternative foods and how that can help with your quote immune system and your overall health. It's just very difficult to get access to those things. I mean, it just, you know, food deserts is a huge problem when it comes to the African American community. When you talk about some of the most marginalized places in every city, in every county, every state.
I do have a couple of resources that I know of off the top of my head. For industry workers who've been laid off, there's an organization called Houston Shift Meal, where they provide, you go on Facebook to their page, Houston Shift Meal, and you can sign up for, they have events all over the city where you can sign up and then go pick up a meal. And they provide that meal for free. And a lot of times they will provide not only meals, but other things that people would need, such as sanitary items or produce and things like that. And then also, I know this sounds odd, but farmers markets are still open and they accept SNAP and WIC. So there are a lot of, I know that Urban Farmers Market Group has a lot of, they have different locations. They also have a drive-through location. So if you're looking for access to food that is still, where you can still use SNAP benefits, that is another resource. But yes, food deserts are a very real thing. I think Facebook has been instrumental in figuring out where people who have recently lost their jobs or who are kind of tight on money can find meals. Again, through Houston Shift Meal, I know several locations around me that are offering a free meal for the day if you simply just sign up.
And April, can you spell that out? Is that Houston SHIFT?
Yes, Houston SHIFT. Like a
someone has posted it. So if you're watching on Facebook Live, they also put it in the comment section. Awesome. To make sure you can get it.
Houston Shift Meal. Thank you. That's awesome.
Now, we have reached an hour, so we're going to wind down. And I want to really thank Cedric and April for coming on. So I'll give you each 30 seconds for a final comment.
Okay. Again, I think the biggest thing that both of us have repeated is that assume that you have it, so that you are trying to interact differently with people. You're trying your best. We know that it's hard during this time, both socially, economically, and emotionally. It's difficult to be isolated or to feel isolated during this time. But the payback is that if we can isolate, that means that when we come back together, we won't be missing anybody.
It's this is tough. It has been very taxing as a healthcare provider. It has been very taxing on me because I worry about my people so much. The African American community has gotten the short end of the stick and continues to do so on so many different levels that has very specific outcomes that are not very good. Mm-hmm. And to see some of the deaths that have occurred, some of the illnesses that have occurred because of COVID-19, some of the inability to access great care, being turned away, it hurts me. I mean, it hurts me to my core. It's painful. But, you know, on my end of it, I just tried my best to inform, be available from a telemedicine standpoint. I don't know how I can do it here. I typically, like I was telling the group earlier as we were preparing for this, I only have probably like 500 Facebook friends, but I always have, and they know this, access to me in regard to my private message or DM that you can get me on Facebook. And I answer questions. I've helped people actually get through it or check in on them daily, just like a telemedicine visit, to help try to, in some small way, be a part of decreasing this disparity that I know exists. Yeah, I don't get paid for it, but I don't need to get paid for it. I'm fine. But if I can help, as many as I can, kind of help navigate through this, then I can sleep well at night, or not sleep well at night, because I actually haven't been sleeping well at night. But I'm not going to give you a bottle of fluff and say, we'll get through this, and I can't do that. I'm worried. I'm worried. I'm not going to give you any anecdotal like we're going to be all right and it's okay. Nah, this is serious. We should treat it as such. So again, try to come up with protocols if you can with your immediate family. Stick to those washing your hands. Be hyper vigilant about that. Please don't be like, it's okay if I do this. No, you just never know. These viruses don't play. And this one right here is not playing around. A lot of people talk about, well, it's just like the flu. No, it's not. How many people do you know right now that die from the flu? Like we've had 20 flu seasons that you've gone through. And I can't tell you one person that I know of personally that died from the flu. I know people die from the flu statistically worldwide, but I don't know anybody personally or in my circle that have died from it, right? And I've had it before. So this COVID thing doesn't have a treatment, does not have a vaccine, and we are under tested. And so those factors, as we start opening up Texas and opening up Houston and so forth, like they're trying to do, to me, that scares me. And it scares me because some of the most marginalized communities are the ones that are going to be the biggest of the victims. And so, that's how I see it. Thank you for having me on. And April, it's been a pleasure meeting you. And
You too.
and I hope I was able to be a little helpful. I hope that's my intent. So thank you.
You guys were awesome, and I want to personally thank you for giving up your time to come and just be there. You've been a help to so many people. I'm seeing things on Facebook. I'm getting text messages. It made a really big difference. So, guys, thank you for joining us for Thinking Thursday. You have doctors that you can get back with. On the screen, you have my contact information. If there are those of you who are having just issues dealing with stress, feel free to reach out. And I want to let you know of another forum that is going on. It is going to be another Facebook presentation presented by the Black Psychologist. It's going to be April 25th at 12 noon. I will post this on my page so that you can have that. But they're going to be dealing with some of the same issues from a mental health perspective. And so I want to put as much out there so people can be aware. Thanks again, and we will see you next time. I'll post and let you know when the next Thinking Thursday, normally it's the third Thursday, but I'll let you know when the next one will occur. Thanks again.
Thank you.
Thanks.
But they're going to